Hello and welcome back to my YouTube channel. In today's video, I will be talking about jaundice. Jaundice is a condition which is characterized by yellowing of the skin, mucous membrane, and within the whites of the eyes. It occurs when bilirubin builds up in the body tissue. This presentation explores the pathophysiology, diagnosis, and management of jaundice across various patient population. Talking about the pathophysiology of development of jaundice. Well, we all know that when the RBCs break down, there is production of hemoglobin, and from that hemoglobin, a yellow pigment called bilirubin is produced. This bilirubin gets conjugated in the liver by the enzymes and which make it water soluble for excretion. Conjugated bilirubin enters bile, move to the intestines and exit in stool. Disruption anywhere in this cycle causes bilirubin buildup, which results in yellowing. So, how does a patient present clinically? Well, the patient can present with scalar icterus, which is yellowing of the eye whites, which appear first and is visible at bilirubin levels more than 2 to 3 milligram per dl. Skin yellowing, jaundice progresses to skin, often noticed in natural lighting. Associated symptoms may include fatigue, pruritus, dark urine, and pale stools. Clinical diagnosis is confirmed with serum bilirubin testing. Levels above 3 milligram per dl typically produces visible jaundice. Types of jaundice: prehepatic, hepatic, and posthepatic jaundice. The prehepatic jaundice occurs before bilirubin reaches the liver and is caused by excessive RBC breakdown as seen in hemolytic anemias or certain hematomas or Gilbert syndrome, and it is a unconjugated type of hyperbilirubinemia in cases of prehepatic jaundice. Hepatic jaundice, it occurs within the liver itself and results from hepatocyte dysfunction. In this, unconjugated and conjugated both type of bilirubin is increased and is seen in conditions like viral hepatitis, drug toxicity, and alcoholic liver disease. In post-hepatic jaundice, it occurs after the liver, that is, it involves when there is obstruction in the biliary tract for by gallstones, pancreatic cancer, or bile duct stricture. In post-hepatic jaundice, generally conjugated bilirubin is increased. Also, in post-hepatic jaundice, alkaline phosphatase level is highly increased. Few common causes in neonates is the physiological jaundice, which affects 60% of term newborns. Breastfeeding jaundice and hemolytic disease also are common in neonates. In children, it can be because of viral hepatitis, genetic disorders like Wilson disease, and autoimmune conditions. In adults, alcoholic liver disease, medication toxicity, viral hepatitis, and gallstones are leading cause. In elderly cancers, especially pancreatic cancer and cholangiocarcinoma, become more prevalent causes. Coming to the diagnostic workup, initial blood tests are done in which complete blood count, liver function test, and bilirubin levels are done, both conjugated and unconjugated. Targeted testing, viral hepatitis panel, autoimmune markers, and hemolysis studies based on clinical suspicion can be done. Imaging studies like abdominal ultrasound, which to evaluate biliary system, CT or MRI may follow for detailed assessment. Advanced procedures like ERCP, liver biopsy, or MRCP may be necessary for definitive diagnosis in complex cases. Treatment approaches based on etiology. Well, first of all, treat the underlying cause. Then, supportive therapies or medications should be given. Specialized interventions like ERCP for stone removal or stenting for strictures can be done. And surgical management is required in cases of chronic cholecystitis or gallbladder carcinoma in form of cholecystectomy or other tumor resection or liver transplantation. For neonatal jaundice management, phototherapy is the first line treatment. Exchange transfusion is done for severe cases. Premature infants need closure monitoring, and early intervention prevents kernicterus. Physiologic jaundice should be distinguished from pathologic jaundice. Physiologic jaundice develops after 24 hours, and pathological jaundice develops within 24 hours of birth. I hope you have understood the lecture well and this lecture was useful for you all. See you in the next video. Bye for now.